There are changes in the hands that seem so small they almost always go unnoticed. Most of the time, they don't mean anything serious. But when they appear recently, persist, or show up along with other symptoms, they can reveal that something in the body isn't working as it should. And the heart, yes, the heart, in some situations, is part of this story. One of the first things that usually stands out is a change in color. The fingers, fingertips, or the area under the nails can take on a bluish or purplish tone. This happens when the tissues receive less oxygen or when circulation in that area decreases. Cold, for example, can cause this effect temporarily, as can Raynaud's phenomenon, where the blood vessels in the fingers contract excessively. In these cases, the color usually improves when the hand is warmed up. However, when the change appears without a clear cause, takes a long time to go away, or shows up along with shortness of breath, dizziness, confusion, or feeling unwell, it's no longer just a matter of temperature. There could be a problem with the lungs, circulation, or heart that's interfering with the delivery of oxygen to the body. But before we talk about the other signs, if you like health content and you're not subscribed to the channel yet, go ahead and subscribe and turn on the notification bell. Also, leave a like. It really helps and will make this video reach more people. And if you want to check out shorter content and see more of my daily life, follow me on Instagram. Let's continue. Not all changes related to oxygenation show up suddenly. Some develop so slowly that a person only notices when comparing their hands to old photographs. The tips of the fingers can gradually become wider while the nails become more rounded and start to curve downward. This change is called digital clubbing, and it usually develops over weeks or months, although the speed can vary. It appears more frequently in lung diseases, but it can also be present in certain heart conditions that reduce oxygenation for prolonged periods, as well as in some infections that affect the heart. Some people naturally have more rounded fingers, especially when the same shape is found in other family members. What really deserves attention is noticing that the shape is changing, especially if this change comes along with tiredness, shortness of breath, or a loss of stamina for activities that used to be easy. When looking at the shape of the nails, it's also possible to notice much smaller changes that could easily be mistaken for dirt or a minor injury. Some people develop thin, reddish, brown, or dark lines under the nails, similar to tiny splinters. Most of the time, these marks are caused by bumps, repeated pressure on the fingers, or cosmetic procedures like manicures. That's why a single line, especially after some kind of trauma, usually isn't a reason to think about heart problems. The situation changes when these marks appear on several nails without any obvious explanation and show up along with persistent fever, weakness, night sweats, or a general feeling of being unwell that doesn't go away. This combination can be present in infectious endocarditis, a serious infection that affects the inner lining of the heart and often the heart valves. The appearance of vertical lines on the fingernails alone is simply not enough to diagnose the disease, and many people suffering with endocarditis don't even show this specific sign at all. Even so, when this particular indicator is part of a broader cluster of clinical symptoms, it is absolutely crucial that it shouldn't be ignored by patients or doctors. And the reason to look beyond the nails is that this same infection can also cause small changes on the skin of the hands. In some cases, reddish and painful bumps appear near the fingertips. In other cases, red or purplish spots show up on the palms, which may not cause any pain. These manifestations are rare and can look like bites, irritations, or small injuries. Once again, the meaning isn't just in how the lesion looks, but in the context. A new mark with no clear cause, accompanied by prolonged fever, chills, loss of appetite, or intense fatigue, needs to be looked at more closely, especially in people who have heart valve diseases, or valve prosthesis or a previous history of endocarditis. There's no need to try to memorize the name of every lesion or to differentiate them at home. Look, what's important is to recognize that an unusual change in your hand, when it appears along with persistent symptoms, could be part of a bigger problem. But not all signs on the hands related to cardiovascular risk are connected to infection or lack of oxygen. Some can reveal that cholesterol has been extremely high for many years. Firm, yellowish, or skin-colored lumps can appear over the tendons on the back of the hands or near the finger joints. These deposits are known as xanthomas and can occur in people with familial hypercholesterolemia, a genetic condition that keeps low-density cholesterol very high, since childhood or adolescence. The danger of this condition is that it can speed up the buildup of plaques in the arteries and increase the risk of heart attack at a younger age. Well, not every lump on the hand is a xanthoma, just like not everyone with high cholesterol develops these changes. Suspicion grows stronger when tests show very high cholesterol levels and there are cases of heart attack, angioplasty, or early cardiac death in the family. In this scenario, healthy eating is still important, but it might not be enough. Many people need medical supervision and ongoing treatment to reduce the risk. After learning about such specific signs, it's natural for a more common question to come up. Do cold or very pale hands also mean the heart is weak? Well, by themselves, almost never. Low temperature, stress, anxiety, anemia, thyroid disorders, and local circulation problems are much more common explanations. Some people just naturally have colder extremities. The interpretation changes when this characteristic appears persistently along with shortness of breath, dizziness, palpitations, swelling in the legs, chest discomfort, or feeling much more tired than the effort would normally cause. In the end, the most important sign isn't a specific mark, but a recent, persistent, or progressive change that comes along with other symptoms. Your hands can offer important clues, but they don't replace medical tests or a doctor's evaluation. Pay attention to your hands, but also listen to the rest of your body. That's all for me for now. God bless, take care, and a big hug.